Mr. President, distinguished delegates, civil society representatives, it is a great honor for me to present my fourth thematic report to the Human Rights Council, which focuses on drug use, harm reduction, and the right to health. I thank all stakeholders for the contributions received. Last year, I undertook 2 country visits to Luxembourg and to Costa Rica. My intervention will also focus on these visits. Mr. President, while the hour is already late, with nothing else left to say or to do with the mandate given to me by this Council, I share in the collective rage and fury as we watch day after day horrific genocidal acts unfold and documented in real time. And in this moment, I bear witness to many people around the world who too, under the crushing weight of imperialism and colonial oppression, know neither peace nor respite. I remain optimistic that world leaders will summon all of the necessary political and diplomatic force to bring an end to all wars around the world and an urgent ceasefire so desperately needed. Mr. President, drugs have been part of human history for thousands of years, whether for medical healing, religious and cultural ceremonies, or as commodities for pleasure. It is crucial to distinguish drug use and drug use disorders. Drug use is not a medical condition. The majority of people who use drugs do not have dependency and do not require treatment. Drug use disorders, including drug dependency, are a medical condition, thus requiring appropriate support and treatment from a right to health perspective. Together, the social, political, commercial, and legal determinants of health can create and reinforce health disparities. With that in mind, I focus on how the availability, accessibility, acceptability, and quality of care is affected by punitive approaches. I explored in this report how drug control compounds and disproportionately affects certain rights and individuals. We must examine the underlying power structures that perpetuate these systems of disadvantage that have outlived colonialism, but continue to shape the underlying dynamics of both drug use and how states respond to it. The intersection of criminal law, health, and human rights is multifaceted. The failure to adopt a human rights-based approach to addressing drug use has had a negative impact, especially on those in situations of homelessness or poverty, people with mental health conditions, sex workers, women, children, LGBTQA+ persons, Black people, indigenous peoples, migrants, persons who are incarcerated or detained, persons with disabilities, those living with HIV, and people living in rural areas. Criminalization is but a single and extreme option within a regulatory spectrum. Regulatory frameworks needed to be cohesively developed by states in a way that is dependent on scientific evidence and considered powered asymmetries and without undue influence from corporations. Mr. President, women who use drugs are also subject to higher rates of violence. Thus, integration of harm reduction services with those for gender-based violence and sexual and reproductive health is required. About 1 in 10 new HIV infections result from drug use by injection. Yet over 92 countries have criminal laws relating to HIV. I urge all states to adhere to human rights principles when negotiating the resolution on human rights in the context of HIV and AIDS. For both conflict and non-conflict emergency situations, access to controlled medicines is a key element to the right to health, including anesthesia during medical procedures and for the management of various health conditions. In this context of harm reduction, my upcoming report to the General Assembly in October 2024 will delve deeper into the themes of sustainable peace and security and sustainable development. All people rely on essential controlled medicines for pain management, for opioid dependence treatment, for palliative care and other health conditions at some point in their life. Given the discriminatory perceptions of pain and who deserves pain relief, this leads to a failure to ensure access to essential medicines for pain relief and drug use disorders, and threatens the realization of the right to health and to the freedom from cruel, inhumane, and degrading treatment. Although not in this present report, I will also pay attention to the current developments and advise on these trends of using the courts in spheres of medicine other than those related to drug use. For example, those seeking to restrict medicines for the management of medical abortions, causing harm to the practice of medicine by unfairly restricting essential medicines contrary to WHO evidence-based guidelines and essential drug lists. Mr. President and distinguished delegates, harm reduction includes a wide range of policies and programs and practices that are aimed at minimizing negative health, social, and legal impacts associated with drug use and drug laws and policies. They work best when they are tailored to the intersecting needs of individuals and the communities aimed to serve them. Some practical harm reduction measures that numerous states have already begun implementing include needle and syringe programs, opioid agonist therapy, drug consumption rooms and supervised injection facilities, drug checking, overdose and prevention and reversal, housing, employment and education, and sustainable funding for programs. And I will take an opportunity later during this dialogue to explain in more details these concepts. Harm reduction measures also focus on the removal of criminal penalties for drug offenses, including for but not limited to use or possession, and is a way of reducing the negative impacts of punitive drug policies on the right to health in particular. I support the full decriminalization of drug use, and evidence from jurisdictions that have taken a decriminalization approach demonstrate that adopting less punitive policies does not result in an increase in drug use or drug-related harms or other crimes. The end on the war on drugs, as this is a war on people, is necessary. I urge all states to be centered on dignity, public health, and human rights. Harm reduction is an approach which will improve trust and dialogue, creativity and innovation in this urgent moment of a paradigm shift that is needed. Mr. President, I extend my gratitude to the government of Luxembourg and Costa Rica for inviting me to assess the realization of the right to health in their countries. And I also express my gratitude to all of the different stakeholders in those countries and persons who met me during both of the country visits. Focusing on my visit to Luxembourg, I commend the authorities for the project adopted in October 2022 on universal health coverage, aiming at ensuring access to basic health care for vulnerable groups of the population who do not have compulsory health insurance, in line with the principles of UHC, health protection, including through social security, must be guaranteed to everyone, regardless of people's professional or administrative situation. I commend the authorities further for the adoption of the agreement between the government and the National Health Funds implemented as of 1st of April 2023, which ensures access to contraceptives without age limit, and I note that family planning services, including emergency contraception and safe abortion services, are largely accessible in the country. At the time of my visit, I was pleased to learn that a draft national plan for mental health was also being discussed. I also observed a collaborative nature of the relationship between the ministries and associations or their NGOs. However, there is an administrative burden that is placed on some associations or NGOs, which tends to be quite large, as some depend on volunteers to implement these programs to supplement what the state should be offering. I also noted that the basis for many interactions between ministries and departments is trust and dependency on individual relationships, arising, of course, from Luxembourg being a very small country. There will be benefit for the whole population if those agreements between ministries and government entities could be codified in some way into law to ensure the perennity of good practices which I observed. There's also a need to ensure the quality and timely collection of appropriately disaggregated data to inform public policy and inform resource allocation, forecasting of needs, and make the reality and the needs of marginalized groups of the population a reality. Finally, I commend civil society and for a follow-up activity already organized after my visits to which I participated, which provided technical capacity to medical practitioners on issues related to intersex persons. On my visit to Costa Rica, I was pleased to learn that the efforts of the government had made since 2016 to move towards universal health coverage and the inclusion of the important number of persons belonging to marginalized groups in the UHC provided by the Social Security Fund. The country's efficient response to the COVID-19 pandemic was made possible by historic investment and political support for the health system. The country developed an operational and technical structure to respond to the pandemic, and the agility of which was illustrated in relation to vaccination programs, public trust, and the national strategic plans. During interviews, including a visit to a mental health facility, there was an overall agreement that mental health was under strain, both regarding the experiences of the population and the responses of the health system. With reference to Bill number 22430, it subsequently became Law number 10412, the National Mental Health Law, post my visit. And I urge, of course, expeditious move to full decriminalization of abortion in Costa Rica, and that criminal and legal restrictions, of course, are discriminatory in nature. Mr. President, I also wish to commend Costa Rica on the National Strategy for Healthy Aging based on the life course of 2022 to 2026, as well as the leadership of many public officials. I was pleased to learn of and witness initiatives on refurbishment and remodeling projects for health facilities and measures improving quality of care, and observed that the citizens and public officials alike carry a sense of pride for their public health system. Mr. President and distinguished delegates, I'm looking forward to continued cooperation with you all to ensure that everyone throughout the world can realize the full enjoyment of the right to the highest attainable standard of physical and mental health, and I remain available to provide technical assistance on aspects related to my mandate. Thank you very much, Mr. President.